I'm really delighted to be here today to speak to you. It's a great privilege to be here on this stage and to consider whether we're prepared. And actually looking around this audience, I'm a little bit concerned about whether we are prepared. Now, I want, if I may, ask you to imagine that you hear about a new disease spreading in Europe. And the first cases arrive here on the south coast of England, here at Weymouth Harbour. And from those first few cases over the next few weeks, you hear about cases all over the country, and including here in Oxford. And the first cases that are here in Oxford, you then learn a little bit more about the symptoms of the disease. Initially, people have a high temperature, and they feel shivery and have muscle aches. Some people go on to get swollen glands in their neck, and others become breathless. And sadly, many people die over the next few days. That initial illness is obviously extremely worrying, and you hear about many cases that are occurring. But as that is happening, you realize that no one knows anything about it. We don't know how it's spread. Doctors don't know how to treat it. We don't have any information about the disease. So added to this fear of the disease and the fear of all this dying around us is the fear of the unknown. Whilst that is going on, there's no information from the government. There's no news anymore. The shops are shut. You can see that the streets are completely empty. And in the midst of all of this, you see your neighbour. And the neighbour says to you that his wife and his two small children developed the illness about a week ago. And now all three of them are dead. And the reason why he's talking to you and looking so distraught is he wants someone to help him take the bodies for burial. And so now for you, added to the fear of the unknown, is the guilt because you don't want to help. Now that was the story of the Black Death, at the time known as the Great Pestilence, which was spread across the whole of Europe in 1348. And as it spread across Europe, it killed between a third and a half of the population. So if you think about the United Kingdom today, that means 25 million people dead. Obviously at the time the population was much smaller. We now know that that disease was spread by fleas carried on rats, and also a lot of person-to-person spread of the bacteria called the plague. And that spread all around the world. But at the time, we didn't know how to treat it. Science was really not there to help, and we certainly weren't prepared. In early 2020, we heard about a new virus that was spreading in China. And here on the 11th of January 2020, in this New York Times headline, you can see the first death was reported. Now, this newspaper article also says that this virus doesn't spread between people, so don't believe everything that you read in the newspapers. But what's astonishing about this, the 11th of January, none of us in this room knew there was a pandemic about to start. And yet on that date, we already knew that it was a coronavirus, and we already knew the genetic code of the virus, which Chinese scientists had shared with us all over the world, so that we were prepared to start making vaccines at that moment. So this was the 11th of January, and over the next few weeks we learned about how the virus spread between people. We also started trials led, perhaps most notably here in Oxford, the recovery trial, which showed which treatments worked, and perhaps even more importantly, which treatments didn't work so that they could be removed and we didn't have the quackery that existed when the plague happened. And perhaps also important is to think about the mathematical models which predicted exactly what would happen if the virus was allowed to spread unchecked. And that allowed governments to put in place social distancing measures and lockdowns, which saved many lives. But crucially, by doing that, we were able to buy time for development of vaccines. And the first vaccines were deployed just 11 months later. Now, I know a lot of you are thinking 11 months is too fast. Why did we go so quickly? But the truth is that those vaccines started their work of being developed 20 years previously. So you have to add 20 years onto that 11 months. The prototype vaccines for coronaviruses were made from 2002, and because there were some small outbreaks of much more dangerous coronaviruses, which really galvanized us into starting working on making better vaccines against coronaviruses. We understood the biology of these viruses and what we needed to do. So that as we approached the pandemic at the start of 2020, we already had vaccines which were tested in animals and protected them from coronaviruses. There were human trials that had been conducted against other coronaviruses, so we knew exactly what to do. And then the icing on the cake was a new coronavirus arrives, and we just have to make a simple switch to do the clinical development. And that development then happened over the next 11 months. And this is the timeline of development of the Oxford AstraZeneca vaccine. And you can see over here the first part, which was the work that had gone on in the many years before, and particularly for our vaccine over the previous 5 years. But then the design and manufacturing, you can see on the green arrow there, was put in place, which took about 3 months before we had the first doses that we could use in clinical trials on the 23rd of April of 2020. And then after the trials started, we were able to start recruiting volunteers and to work out whether the vaccines worked and how safe they were. And what is absolutely critical here is to understand that these trials were exactly the same as clinical trials of vaccines that have been conducted over the last 30 years. Exactly the same, except that they were much bigger than almost any vaccine development program before, so we had a lot more data than normal. And secondly, they were conducted in the full glare of the media. Now, I am delighted that for once people are interested in what I do in my job, but it was also a little bit traumatic to have, at the peak of interest, 1,000 journalists per hour contacting the university, because there's a lot of journalists around the world, and we had 18 staff trying to deal with that huge interest. So those early trials built up to very large-scale trials that you can see here in brown, which are the trials that were conducted across 3 continents, in Latin America, here in the UK, across all the UK, and in South Africa, 32 trial sites, thousands of volunteers taking part across those sites. And that was the most enormous undertaking in peacetime. But imagine doing that in a global lockdown with no supply chains. You couldn't buy thermometers that you needed for the trials. You couldn't ship the supplies, even needles and syringes, to the clinical trial sites. Absolute nightmare of logistics. And the worst moment for me was a Sunday afternoon. We knew that the week ahead we had lots of appointments booked, and I could see we would run out of doses of vaccine for the trial. And so I had to make the decision to phone a company up who would ship vaccine from Italy, where we were manufacturing it at the time, on a private jet. That in itself was a big step, but even worse was the call the next morning to tell the university I've just spent £25,000 on a private jet in the middle of a pandemic. So these clinical trials were amazing. There were 2,000 staff around the world who worked on them, the most inspiring people. And they knew what they were doing because they're there in peacetime, working on development of drugs, vaccines, to improve our health. And they all stepped up to come and work together in this huge global collaboration for this. But perhaps even more inspiring were the volunteers who took part. 25,000 people in our trials, perhaps some people in this room who took part in what I believe is the greatest collective research endeavor that we have seen in our generation. Absolutely amazing. And when you think that this is across all the programs of many vaccines being developed, it's all about the public and them taking part, which had this huge impact. So as we move over to the left-hand side is the last bit, which is getting regulators to approve the vaccine. And as you heard in the introduction, the vaccine was then approved in over 180 countries, and with AstraZeneca's huge efforts, distributed all over the world with 3.5 billion doses supplied. The impact of this vaccine program here in the UK is astonishing. And it's not just the Oxford vaccine, we had Pfizer and Moderna's vaccines as well. The combination of the vaccines which were developed have had this huge impact. And on this graph, I'm showing you the mortality in this country from COVID. And you can see over on the right, there's two very big peaks. The first is as the virus arrived here in the UK in early 2020. And the second one at the end of 2020 was before the big second lockdown, when the Alpha variant arrived. It was known initially as the Kent variant because it was first detected in the south of England. And that second peak is a peak caused mostly by the Alpha variant. But what is astonishing from this slide is that is the end of the pandemic deaths after those two peaks. And they ended because of the rollout of the vaccine program, which started at the end of 2020 and early 2021. So if we were to look at it from a global mortality perspective, countries that rolled out their vaccines early, the pandemic was halted by the vaccine rollout. And we haven't returned to that. Now, we do here have small numbers of deaths that are still occurring associated with COVID, just like with other viruses that spread in our population, influenza, for example. The frail and the vulnerable in society still will succumb to that. But we don't see the pandemic levels of death that were there before. To look at what the global impact is also, I think, very illuminating. On this slide, I'm showing you that in 2021 alone, somewhere between 14 and 20 million lives were saved by the global vaccine program. And what this shows you, these different colors, is different regions of the world over that year, the number of lives that was saved. Incredible impact. And the analytical company Airfinity has split that by different vaccines to try to give an idea of the impact in 2021 of the different vaccines. And you can see at the top, the Oxford AstraZeneca vaccine saved around 6.3 million lives, the Pfizer vaccine about 5.8 million lives. But all of these vaccines have made this huge contribution to give us this impact in the pandemic. Now, that shouldn't really come as any surprise, because when we look at how impressive vaccines have been in altering public health over the last 60 years, you can see that on the left of the slide here, before the vaccine programs came in the UK in 1963, we had vast numbers of cases and deaths from diseases like measles and diphtheria that you can see on this slide. And now we have got these diseases completely under control. We have a break on these infections which threaten us as a result of the vaccine program. We are really today living in a completely changed world when you contrast where we are with the 2020 pandemic with where we were in 1348. I just want to make the point that it's not as if in those 700 years there were no other pandemics. There were rather a lot of other pandemics, but it's just useful to talk about the worst pandemic we have recorded, where perhaps as many as 200 million people died in the Great Pestilence of 1348, with the situation with the COVID pandemic. We've had multiple plague pandemics over the course of that period, the most recent of which only was declared over in 1960. Also, in the last 150 years, there have been astonishingly 6 influenza pandemics, the most serious of which many of you will have heard about, the 1918 Spanish flu pandemic just after the First World War. So pandemics have been a real feature of our interactions with the outside world over the last 700 years. Now, I said earlier that about half of people who got plague died, half of the population were wiped out by plague. And although for all of us it's been incredibly traumatic to go through the COVID-19 pandemic, we were pretty lucky. Less than 1% of people died, even before the vaccines were available. So that pandemic was a mild one in comparison to the plague pandemic. It's also worth pointing out that although I was hyping up vaccines, there are about 350 vaccines that have been in development for COVID-19, and yet we only had a handful available in the first part of 2021. And even today, the World Health Organization has only approved 8 vaccines. We've had a lot of attempts, but a very small number of hits on target. And the reasons for that, I've just listed some on this slide. There are many reasons why those other vaccines have not been successful. And when we look outside with the recent year or so, we are currently under siege by the microbial world. There are multiple diseases that are threatening us with small outbreaks, small numbers of cases, but they are threatening us every single month. And you can see here some examples. There's Ebola, there's outbreaks of cholera, and a mysterious hepatitis virus, which had a very serious impact on young children. So many different diseases. And one that's particularly worrying to me was the H5N1 avian influenza, which we heard about before Christmas. And here, as you can see, particularly affecting turkeys. Now, I'm not worried about it because it affected turkeys on the Christmas dinner table. What I'm worried about it is that this is a virus that has not before spread in human populations, this type of flu, this bird flu. And if it mixes with human viruses, which enable it to start spreading amongst people, that is what would initiate a pandemic of this flu virus, which could be very serious. Just this week, we've heard that this virus has been found in a mink farm in Spain, spreading between those mammals. Of course, we're also mammals. Back in 1348, probably what initiated that pandemic of devastating scale was climate change. We believe now, many academics believe, that changes in the climate drove the rodents which were carrying these plague-ridden fleas from their normal habitat, so that they could then transmit the fleas to other rodent populations around the world. And the change in temperature also meant that fleas survived better, and there were more of them and they multiplied. And that created the perfect situation for the initiation of a pandemic. Now, some of you might have heard that there's concerns about climate change today. And those concerns about climate change are obviously a health threat in their own right, but they're also an existential health threat when we think about outbreaks of disease. Just in the last few years, we've seen the spread of some viruses into new territories as a result of climate change. Dengue and chikungunya, 2 viruses which are carried by types of mosquitoes, have spread into new areas of the world that they weren't in before. This is exactly the sort of scenario where climate change might drive a new pandemic. Of course, the other really important thing about pandemics is to crowd lots of people together. And actually, looking in this room, we seem to have done that quite well. In the next 30 years, the population of the Earth will reach 10 billion people. And it'll stay like that for the rest of this century. As that increasing population is crowded, increases the chance of spread of new diseases before we can stop them. It also means that people start to encroach on animal habitats, so that we're more likely to meet animals in the wild and their viruses and bacteria, which could then mutate to learn how to spread in human populations. And of course, we're obsessed with travel, which is a great way to spread diseases around the world. Now, this is all a bit worrying, but actually, we've got this. Science has got this. Scientists around the world have got this. We are today in the perfect situation to be able to control future pandemics because of what we know, the moment that we've arrived at with scientific endeavor. Here in Oxford, there's a Pandemic Sciences Institute being built at this moment to try to get us to a situation where we are ready. We need good global surveillance. We have to do planning about different scenarios. What if instead of particularly affecting older adults, we have a disease which spreads mostly in children or in pregnant women or in young people, as the Spanish flu did? We have to be prepared for these other scenarios for different types of infections. We also need to work out how to make vaccines faster and to think about how we invest in the staff who are required so that we can respond if a pandemic occurs in the future. Now, in order to do that, to make sure our homework has all been done, that we, just like we were with coronaviruses, that we know for all of the other diseases out there exactly how to make the vaccines, we have a lot of work to do. And I think one of the really positive noises that there's been, this is in the middle of 2021, the G7, the richest countries in the world, came together and they say, when the next pandemic comes, we have to be ready to deploy vaccines and other treatments at scale within 100 days. In COVID-19, it took over 300 days to have the first vaccines available and a little bit less for the first treatments. So we've got a lot of work to do to bring that 300 down to 100. But I'm confident that if we do our homework and prepare, that we will be there for the next pandemic. There's a lot to do to make sure that happens. So I think when I look at all of this together, I really can imagine a world where we are well prepared for the next pandemic, as long as we do our homework. I can imagine it because, of course, we've just been through that, and what we'd like to do in the future is to do it faster. And the reason for doing it faster is that if you just look at COVID, with that very low mortality rate overall, 10,000 people were dying every single day globally in 2020. So you don't have to shave off more than a few days to have a huge impact on global populations if you can make and deploy vaccines more quickly. I can really imagine a world where we can do that. And the reason for that is that we are the first generation who has witnessed science halting a pandemic. And I'm confident that if we do our homework now and we make sure that the proper investment is there in the people and the capabilities, that in the future, science will prevail. Thank you.